The dynamic Loewenstein Occupational Therapy Assessment for Geriatrics, or Dlotca-G, is a battery assessment used to assess basic cognitive skills. This test is primarily used on clients who have suffered from a stroke or traumatic brain injury. However, newer versions are able to assess clients with neurological conditions. This assessment is used for clients specifically aged 70 to 91, but there are other versions that are able to assess pediatric and adult populations. The assessment consists of various subtests that the client completes, each one relating to an area of cognition. Each Dlotca comes with the items you see, a manual, test booklet, and pegboard, as well as this container full of other items needed to complete the assessment, such as colored blocks, scissors, pegs, and other household items.
Hi, how are you doing today?
I'm good. How are you?
I'm good, thanks. My name's Angie. I'll be your occupational therapy student.
Cool.
So why don't you tell me a little bit about yourself before we get started?
My name is Abby. I'm in the hospital from falling off a ladder.
Oh, okay.
Yeah.
We proceeded to chat for a few minutes before the assessment began.
Well, thanks for sharing a little bit about yourself with me, Abby. We're going to go ahead and get started here, okay? I'm going to start by asking you a couple of questions, and I just want you to answer me. Where are you now?
The hospital.
What city?
The first category of the assessment is orientation. In this category, the client is asked where they are, where they live, what day, month, and year it is, where they have been, what season it is, what time it is, and how long they have been in the hospital. This is to assess their overall orientation to place and time.
So what happened? Why are you in the hospital?
I fell off a ladder and I hit my head, and I think I had a little bit of a brain injury.
Okay. How has your thinking or memory changed at all? Or if it has changed at all?
It's mostly just headaches, and I have trouble with short-term memory.
Okay. Good to know. Thank you. All right. I'm going to show you a picture of a famous person, and I just want you to tell me who it is.
The next category is memory. The client is asked to identify a famous personality. They give a personal item to the administrator, and it is placed on the other side of the room, and they are shown 5 common items and asked to remember them. In 20 minutes, the administrator will revisit this category and ask the client to recall all of this information.
Key. Candle. Salt shaker.
Good. All right, I'm going to present you with a few objects, and I want you to tell me the name of them as I present them to you, okay?
The next category is visual perception. The client is first shown cards containing 4 items and is asked to identify them. Then the client is shown a card with 3 overlapping outlines of fruits and is asked to name all the fruits they see. Next, they are shown 3 images taken from odd angles and asked to identify them.
All right, so the next part, I'm just going to ask you to show me some of your body parts and just raise them up to me, okay?
The next cognitive item is spatial perception. The client is asked to identify body parts on themselves by raising them up to the administrator. Then, the client is asked to complete simple spatial commands, such as place your right hand on your left ear. Then the client is asked to identify body parts on the administrator by pointing to them. Finally, the client is asked what side objects around the room are located, either to the right or the left.
Your left side. Good. Next, I'm going to demonstrate a position, and after I finish, I would like you to do the same as if you were looking into a mirror.
Motor praxis assesses the individual's ability to imitate motor actions like they were looking into a mirror, use objects such as a comb and paper with scissors, and perform symbolic actions such as using a phone without the physical object.
Now I'll ask you to do some actions without objects, as if you're using them like a pantomime. As soon as I finish explaining what to do, start performing the action. Show me how you brush your teeth. Good. Show me how you open a door with a key. Good job. Show me how you slice a piece of bread and spread something onto it. Excellent. Show me how you use the telephone, including lifting the receiver, dialing a number, and bringing the receiver to your ear.
Beep, 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 beep. Hello?
Great job. I'm going to show you 3 cards with shapes on them. I want you to copy each shape on the paper. Tell me when you finish.
The visual motor section contains many subtests, including copying simple shapes, reproduction of a 2D and 3D model, reproduction of a pegboard design, as well as reproduction of a puzzle.
I want you to build this pattern besides the picture. What you build should be the same as the picture, and the pieces you need are in front of you. Tell me when you finish.
Good.
Perfect. All right, next up. All right, I want you to construct this pattern on the board. It should be identical to the size and position on the board as the picture. You can tell me when you're finished. Finished?
Yes.
Good. All right, so I want you to build the design with the blocks. Tell me when you're finished. Good job. All right, I want you to build the puzzle on the picture using these pieces. You tell me when you're done. On the puzzle.
Okay.
Good job. All right. Fill in the numbers of the clock and put the hands at 11:10. Tell me when you're done.
The clock draw test is a common screen tool used to identify neurological deficits, and it is a part of the Dlotca-G.
Perfect, thanks you. All right. I want you to sort these cards into groups and then name each group.
The thinking operations category assesses the individual's ability to complete tasks, including sorting, categorizing, and picture sequencing.
Is there another way that you could put these cards into groups? Good, nice job. All right, at the beginning of the test, I showed you a picture of a famous person. Do you remember who that is?
Obama.
Good. At the beginning of the test, I took something and I hid it. What did I take?
You took my phone.
And where did I put it?
Over there.
Great. I will show you 10 objects, one after the other. Tell me if I have shown them to you previously or not.
As previously stated, the memory portion is revisited after 20 minutes. If the client is in the middle of a task, then they complete it first before moving on to this.
Great job. All right. I want you to arrange these pictures in the correct sequence and then tell me the story.
Man sees tree with a ladder. Man uses ladder to climb tree. Man takes apple from tree. Man sees woman. Man gives apple to woman.
What story do you think it is?
I think it's Adam and Eve.
That's a great guess. I think it is too.
Yeah, because they're wearing
You did a great job today, and I really appreciate you taking your time to work with me.
Scoring is done by making observations throughout the assessment, as well as before and after mediation scores and mediation required. A higher score indicates better performance from the client.